Hello and welcome back to Pharmacist Michael's Happy, Healthy Living. Today we're going to talk about whether you should use Mounjaro to lose weight and what are the factors that you should think about when making that decision. Weight management is a topic of immense importance in today's world. While diet and exercise remain the cornerstones of a healthy lifestyle, pharmaceutical interventions are becoming increasingly common. Mounjaro is one such drug that has generated interest in the field of weight loss. Whether you should take this for weight loss is a complex and multifaceted decision that requires careful consideration. Mounjaro is an FDA-approved medicine primarily prescribed to manage type 2 diabetes. This drug increases glucose-dependent insulin secretion, decreases inappropriate glucagon secretion, and slows gastric emptying. Because of these factors, this medication has been shown to help people lose weight. Here are some factors you should consider before deciding whether to take Mounjaro for weight loss. Mounjaro is generally prescribed to adults with a body mass index or BMI of 30 or higher, or those with a BMI of 27 or higher who have weight-related health conditions. As most of us know, medication should not be seen as a standalone solution to weight loss. Your success often depends on changes in diet and exercise habits. Mounjaro is typically prescribed as an adjunct to a reduced calorie diet and increased physical activity. Side effects are a big deal and really should be carefully examined. Common side effects of Mounjaro include nausea, which happens in about 12 to 18% of patients, vomiting, diarrhea, it happens in 12 to 17%, and decreased appetite, which happens in about 5 to 11%. Now let's talk about the more serious side effects. It is true that these may not happen to you, but my job as a pharmacist is to make you aware of them. Because Mounjaro can cause diarrhea and vomiting, there is a risk of dehydration. This may lead to acute kidney injury, which can have severe consequences. Gallbladder problems have been reported as well. Contact your healthcare provider immediately if you experience pain in your upper stomach, fever, yellowing of your skin or eyes, and or clay-colored stools. Pancreatitis can also happen when taking Mounjaro. This condition can also be life-threatening in some cases. Symptoms of pancreatitis include moderate to severe pain in the upper part of your belly, which radiates to your back. Eating may make this pain worse, especially foods high in fat. You may have a fever, a higher than normal heart rate, nausea and vomiting, swelling and tenderness in your belly. This is the one that really got me, which is the risk of thyroid cancer. I mentioned this in my initial Mounjaro video. You have to ask yourself whether losing weight is worth possibly ending up with thyroid cancer. And of course, there's always a risk of severe allergic reactions when you start a new medication. The cost of Mounjaro may also be a consideration, as it can be very expensive, and insurance coverage may vary. Be sure to explore the financial aspects and whether it fits within your budget. The use of Mounjaro for weight loss is generally intended for the short term. Once weight loss goals are achieved, discontinuation of the medication may be recommended. The big question is, will you gain the weight back? if you don't change your lifestyle, the chances of gaining back the weight you have lost with Mounjaro is high. It's important to consider your own weight loss goals and the reasons behind them. Are they primarily health related, or are you seeking an aesthetic change? Understanding your motivations can help guide your decision. I'm going to stress that, in my opinion, you should never try to lose weight specifically to try to impress others or as a way to increase your happiness. Being thin will likely not make you happy, and people who don't like you because you gain a few pounds aren't worth keeping around. Whether you should take Mounjaro for weight loss is a decision that should be made in consultation with a medical professional. It is not a one-size-fits-all solution, and individual factors including eligibility, lifestyle, potential side effects, and personal goals should be carefully considered. Weight management should always prioritize your health and safety, and any medication should be seen as just one part of a holistic approach to a healthier life. If you've enjoyed this video, please give it a thumbs up. And be sure to subscribe to our channel for more happy, healthy living information. My name is Pharmacist Michael. Be happy and be healthy.